Okay, is everyone ready? Good to go? All right. Well, good morning. In the last 24 hours, the ACT has recorded one additional COVID-19 case, a close contact of the previous cases, taking the total number of active cases to 7. At this stage, none of the active cases are hospitalised. Yesterday, more than 4,500 tests were collected across ACT government testing sites and private providers. Nearly 3,200 of those tests were at the ACT government sites. This was a record day of testing in the ACT. We appreciate that there is significant demand for testing. Yesterday at Exhibition Park, a test was conducted every 45 seconds. With increased capacity at Exhibition Park today, we anticipate a test being able to be conducted every 30 seconds. We continue to look at opportunities to expand our testing capacity, and an example of this is the specific pop-up related to the Gold Creek Holy Spirit schools in Gungahlin. The government continues to focus on testing, contact tracing and supporting those who need to get tested and those who are experiencing anxiety and need at this time. So we have partnered with community sector organisations to provide additional funding and support for the Canberra Relief Network to provide food parcels for those who are in great need at this time. In terms of exposure sites, the detailed information on new exposure locations is updated twice each day on the ACT Government COVID-19 website. This is an important reference point for people wanting to understand as new tests come in, as people test positive, and our contact tracers do their work. This is how we can identify future exposure risks and past exposure risks for people who may have been in the same location with a positive case. It is encouraging that so many people have come forward for testing, and we are aware that there were significant delays yesterday. It was a very significant day of testing, though, that gives us a great deal of surveillance in terms of the spread of the virus across the community. Hundreds and hundreds of tests have already been conducted today, and we will update results of that testing at tomorrow's press conference. I want to conclude today with a very clear and simple message for everyone for this weekend. Please stay at home. Only go out if you absolutely need to. The best thing that you can do to protect our community, to protect your family and friends and yourself, is to stay at home over this weekend. I'll now invite Minister for Health, Rachel Stephen-Smith, to provide some further information on the testing program, and then we'll be available for questions. Rachel.
Thanks very much, Andrew. I'm Rachel Stephen-Smith. I'm the ACT Minister for Health. And I just want to start, as I'm sure all Canberrans are, acknowledging the exceptional commitment of all of those who are working on the front line of our health response, and particularly those who are involved in operating our testing sites. Not just ACT government, but across the private testing sites as well, and particularly Capital Pathology has had a number of sites open, and I know people have been using those as well. But I also want to acknowledge that we've had a number of people join our team in Canberra Health Services to assist with testing, both across other parts of Canberra Health Services and from outside, from the ACT Health Directorate, from other parts of the ACT Public Service. So we're drawing on resources where we can, and we also have sought support from the private sector as well. All of these people are going above and beyond to help our community, and so we just urge everyone to continue to treat them and each other with kindness and patience. We know there have been some long waits, and I'll get to that in a moment. But I do also want to thank everyone. By and large, people have been incredibly collaborative, cooperative and supportive of our staff. And even in the commentary that we're getting about the frustration with wait times, people are acknowledging our fantastic staff and the great work that they do. So thank you for that. It was very disappointing last night to learn that some additional cars had to be sent away quite late, despite waiting for some very long hours. And unfortunately, that situation occurred. The team tried in the afternoon to identify how many people were going to be able to get through and to give early advice to those who weren't going to be able to be tested yesterday. Unfortunately, there were quite a number of cars that had more than one person needing to be tested, and that meant that there was just a few cars at the end of the day that had to be turned away a bit later. And so, we apologise for that, and we apologise particularly to those who were affected by that, and we understand their frustrations, but it is also really important that we continue to look after our staff and continue to look after the public. We want those staff to be able to come back and keep doing that work. And we also, anyone who was out and about very late last night, probably not many, due to the lockdown, or up early this morning would have known it was very cold overnight last night. So we do need to take into account the working conditions for our staff as well. So while this unprecedented demand for testing is challenging, it also gives us a reason to be proud of our community. Canberrans are proving once again how committed we are to responding and doing the right thing during a pandemic. Today, we've opened additional testing space and boosted capacity through a significant surge in staffing numbers across all 3 sites. So for those who might have been out to Epic, or for those who are familiar with the site, we have opened the second site at the Budawang building, where the original COVID drive-through testing site was at the Epic Centre. So there are now 2 separate lanes going through Epic. In addition, Brindabella Park, new traffic arrangements are in place at Brindabella Park to assist with managing the flow of COVID-19 testing traffic into the clinic. And again, I drove past there this morning and all the traffic arrangements were in place at about 8:40. Things seem to be flowing really smoothly there. I'm sure the lines will have built a bit since then though. Signage is in place along the road to guide drivers in off Pialago Road and along the preferred route. And our priority, of course, while testing demand rate remains high, is ensuring that those who have been directed by ACT Health to get tested can do so as soon as possible. So another reminder to people, if you don't have symptoms, you haven't been in an exposure location, you haven't been asked by ACT Health to go and get tested, the best thing you can do to support our public health response is stay home. I know people are anxious, but we really need to test those people with symptoms and those people identified by ACT Health as potential contacts. Just in terms of timing, the drive-through at Epic and Brindabella Park are continuing to commence testing at 8 a.m. and operate until late, while Western Creek is open from 7:30 a.m. to 10 p.m. each day. Gates, however, will open at Epic at 7 a.m. to allow cars to enter the site ahead of testing getting underway. The Chief has talked about, the Chief Minister has talked about the pop-up site at Gold Creek for that particular community. We are also working towards the re-establishment of the drive-through testing facility in Canberra in partnership with Capital Pathology. So that work is underway and we expect to have that site up and running on Tuesday. So that's taking a few days to get set up, but Capital Pathology have been great partners in this at Gold Creek, and we look forward to that site opening in Canberra. I also finally just want to give a shout out and a thank you to the Emergency Services Agency, the SES, Rural Fire Service and Community Fire Unit staff and volunteers who have been assisting yesterday and will be there through the weekend at our testing sites to support people while they are in line. We have heard feedback from some people that people with specific vulnerabilities and needs might need a bit of extra support, and we've asked that that our volunteers keep a particular eye out for people who might need a bit of extra support, might need a bit of help to be either fast-tracked through the process or supported while they are waiting. For those who are not going to be able to wait for testing for a reason of particular vulnerability, health condition or disability, we do encourage you, particularly if you're a contact and ACT Health has already contacted you, please get in touch with ACT Health so that we can arrange a pathway to testing that is appropriate for you. We are very keen to support those people who might have difficulty accessing our mainstream testing sites to ensure that everybody can be tested as quickly as possible. So with that, I'll hand back to the Chief Minister for questions.
Thank you, Rachel, and we'll start on this side. Jasper.
Chief Minister, we now have exposure sites on Sunday and Monday. Is there any update on genomic sequencing? Can we say anything about the original sources of these infections and whether they are linked?
Sure. I'll invite Dr. Coleman to address that.
Good morning still, everyone. Thank you. Yes, the whole genomic sequencing does confirm a link with several cases in Greater Sydney for the source case in the ACT. Thank you.
How about the link with the student, the Gold Creek student?
We're still investigating that and we have no further update. The whole genomic sequencing is still being conducted.
Is ACT Health confident that the first identified case is the original case in the ACT, or are you investigating a possibility that there are cases prior to that? And if that's the case, given the experience with the social media commentary around that first identified case, are you concerned that whoever that might be would be reluctant to come forward for testing?
There's a couple of parts to your question. I think in these cases, public health investigation is always ongoing and always open to all potential options. It's one of the reasons why we are keen to get through our contact testing as well as anyone who is unwell as we can in supporting our people. So I'm not 100% confident of anything at the moment. All options are on the table, but I am comfortable that this case is linked to Greater Sydney and it has not come out of somewhere else or out of its own, which is really good. Can you just remind me what the second part of the question was?
You're concerned that someone might be reluctant to come forward for testing and that they were a previous case before the already identified ones?
Yeah, look, I've discussed this a little bit in the last couple of days. I think I am increasingly concerned with the community narrative where we're putting blame on individuals in an environment where it may not be safe, for people may not feel safe coming forward. I think all of the ministers and myself have expressed just a little bit of frustration with that, and we're really begging people. This is about keeping people safe, making a safe environment for people to come forward and to give us as much information as they have and they can remember. We're doing really well at the moment. This is a fantastic response, and I am confident that we will continue to work through this in a really positive way. But it's a critical time for people to recognise that everybody has a role to play. If that's not about their own individual role to come forward for testing when and if they're advised to, it's also about us taking responsibility for our own community. This is my community. This is where I live. I want to be kind to other people. I want to give them an environment where they come forward and do the right thing. Thank you.
Chief Minister, only one new case today. That seems like pretty good news to me. How are you feeling?
Well, certainly a lot better with that information, but it's one day at a time. In light of what we've seen up the highway in New South Wales today, that just serves as a reminder of how this can get away quickly. So a good news day today for us, but we've got a lot of testing still to get through. I'm pleased that we locked down when we did. It was definitely the right decision and has clearly reduced the risk to our community. So that was absolutely the right thing to do. And if this continues, where we have very high levels of testing and we continue to get low case numbers that are close contacts and we're able to isolate those people, then that is the very best public health response that we can put in place.
466 new cases in Sydney today. What do you think about calls for a New South Wales statewide lockdown, and do you think that's necessary?
Well, look, I'm not providing running commentaries on every other jurisdiction's response. Obviously, everyone is concerned. We've got family and friends in Sydney. Everyone is concerned about what is happening. It is just distressing and causes anxiety for everyone. I understand that.
What about for our particular region? We are very close to
Yes,
New South Wales.
So I raised this in National Cabinet with Premier Berejiklian yesterday around a need for stronger coordination between the ACT and New South Wales as it affects the Canberra region. She gave me her personal undertaking that on the New South Wales side they would work on that and acknowledge that there are some challenges in communication at the moment. So I hope that those things are improving and will undoubtedly need to continue to be a work in progress as particular quirks or circumstances are brought to the respective government's attention. But it's good that people are advising of where there are potentially quirks in the system that we can address. Nothing is ever perfect immediately. But as I've mentioned in this forum many times, we don't want to repeat mistakes. So if we can identify issues and resolve them, then we endeavour to do so as quickly as possible.
Chief Minister, just one new case today. Does that take into account, do you think, the record day of testing, or do you think we'd see that taken into account in tomorrow's numbers?
Well, the day before was the previous all-time record for tests, so I think we're seeing a really strong response. Look, of course, as I'm cautious about what we're seeing today. Clearly, 1 is much better than 460. 0 would be even better, and so that's what we're working towards.
What I mean to say, though, has a record day of testing been processed yet?
There are obviously hundreds and hundreds of tests being processed that have started being taken this morning as well. So tomorrow is another significant day for us. As each day goes by, we get more information. But to put some perspective on this, the total population of the ACT is a little over 430,000. So 4,500 tests in one day is more than 1% of the population. That is a very big sample or surveillance number. It's a good number in which to get a really good sense of what's going on in terms of the spread of the virus in the community. But we're going to have another day like that, I suspect, in terms of really strong testing numbers that will put us in an even better position to understand what's going on. We've got more exposure sites though. Last night it was updated over, I think, 39 sites in total now. So I encourage people to continue to look at the COVID-19 website, the ACT government website, for the latest information. People will also find there the answers to most of the questions that are being asked throughout the community at this time.
And if the numbers tomorrow or Monday are still continuing around, 1 or 2 new cases, would you consider lifting the lockdown early?
Well, we will, as we have always done through this pandemic, be cautious, listen to the advice of the Chief Health Officer and make well-informed and considered decisions. Clearly, the lower the case numbers and the closer we get to 0, the closer we are to coming out of the lockdown. But we need many more days of this sort of high level of testing and low level of new cases. Yes.
Can I ask, the Chief Health Officer said that the first case is linked to Sydney. Do we know yet how they got that? Potentially whereabouts in Sydney, and the new case for today, is that a close contact of the original case or a close contact of the school student?
I will ask Dr. Coleman to address those two questions.
So the first question is an ongoing investigation, but it's reassuring that it is linked to the Greater Sydney outbreak. The second question, the new case today is definitely a close contact of an existing case, so that's reassuring as well.
Can you say the original case or whether it's part of the Gold Creek school?
I'd prefer not to just at this time because this case is hot off the press and I want to make sure that everybody who needs to be notified is notified before then.
And can you give us a little bit more detail about Sydney? Can you narrow it down to a particular part of Sydney where potentially that may have come from?
No, and to be honest, it won't make any difference to the public health response, so I'm not interested in pursuing that aspect. Thank you.
Masks and glasses are difficult, yes.
Chief Minister, we've obviously seen people waiting for hours to get their tests. There's concern that the people might be mingling while waiting for that test. What's been done to address that particular concern?
Yes, so there's obviously a lot of support on the ground through ACT emergency services, through additional ACT health staff. Clearly, I've been very straightforward in our messaging that the potential of transmission of the virus is when people come into close contact with each other. So if you are in the line or intending to go to get tested, clearly have your mask and avoid close contact with other people.
And on National Cabinet, I know you said that Gladys Berejiklian gave you her personal undertaking in that concerns around the border issue. What about the concerns that were raised in particular by Queensland about the need for a containment plan? The situation obviously isn't getting any better. Have you been convinced that New South Wales does have a solid containment plan?
Well, they announced, I think, a further set of measures after National Cabinet yesterday afternoon. So they have continued to respond to the situation as it has emerged. Look, in hindsight, I'm sure they would have undertaken some slightly different and earlier action, but everyone has perfect vision in hindsight. And as I've mentioned before, the lessons are there for everyone to learn from each outbreak. And there've been a number of them around the country. And so what we've been seeking to do is learn those lessons. And as I've been saying, mistakes will be made. There's not an absolute rule book for how you respond to a pandemic in every single circumstance, but we are learning along the way, all Australian governments, state and territory and Commonwealth. And so it's my hope that the same mistake is not made twice. And so there are lessons in this and what's happening in New South Wales for everyone.
There are ANU students who have been identified as close contacts living in accommodation with shared facilities on the campus. Will they be moved to alternative accommodation given the risk of transmission in those kinds of residential halls?
Dr. Coleman will address this one.
We're working closely with the ANU authorities on managing this, those primary and secondary close contacts on ANU very competently. I'm very comfortable with how that's being managed. At the moment, the secondary close contacts, who are the contacts of the primary contacts, are looking at hopefully being released very shortly once all of the first tests are negative. So that's really good news. Thank you.
Are we able to get an update on the number of close contacts, casual contacts, and then perhaps compliance from the Chief Police Officer, if that's okay? Has been any compliance?
Sure, yes. So whilst Deputy Commissioner's coming forward, so yes, that obviously the number of close contacts increases as more exposure sites are identified, and the information from the Check in Canberra app provides us with really useful information, so that is working well. The numbers are around 4,500. Now, obviously, we've been working through those. That's an update on, I think yesterday we were at about 3,900 from memory. But I'll invite the CPO to address the compliance matters.
Thanks, Chief. Good afternoon, everyone. Well, compliance has been excellent. So I thank Canberrans for adhering to the health directions. It's all about keeping each other safe, as well as home quarantine. Obviously, we're doing a lot of work on the border. Yesterday, we spoke to approximately 360 cars. Unfortunately, we did turn 12 away. And we're going to do some work with New South Wales Police in coming days on entries and exits into the territory in a combined effort, and to make sure that that compliance rate improves.
Chief Minister, are you considering prioritising vaccines for younger people, given some of those exposure locations that we've seen, particularly around the nightclub and then now with Gold Creek School?
Yes, so we already have a prioritisation for 12 to 15-year-olds who are vulnerable. As more vaccine supply becomes available, it is our intention to open up vaccination to people aged 16 to 29. We are working with the Commonwealth Government in relation to the Moderna availability that's coming next month. Obviously, there will be a partnership between the Commonwealth and the ACT Government that will involve pharmacies, GPs and our own programs. We're very focused on delivering all of the Pfizer that we have, and we have a really strong take-up, particularly from the 30 to 39 age group. But we will be opening up more opportunity for vaccination, and it is, as it has always been throughout the pandemic, linked to the available supply that comes into the territory from the Commonwealth. There is AstraZeneca available, and the best place for that is a conversation with a trusted health professional. So there is AstraZeneca available through GPs and pharmacists. So I think that's been said many times that the best vaccine is the one that's available to you right now, and that is definitely the case, that there is availability of AstraZeneca in the ACT.
Can I ask you about the free food program that you announced today for vulnerable Canberrans? Tell me about that. How much funding has been allocated for that program? Will it be extended if the lockdown is extended? And also, are you considering putting homeless people up in hotels like Sydney has done?
Okay, so it's a program that people would be familiar with. We ran it last year. It's an extension of that relief network with a range of partners. The initial funding is around $250,000 at this stage. That is obviously flexible and can be extended if necessary. In relation to accommodation, we obviously have a range of support services for people who are sleeping rough or who are homeless. We will look across our support network to ensure that we are able to provide services for those people.
We'd also heard rumours this morning that the gates had been closed at Epic quite early in the morning. I know there was some commentary this morning at about 8:30 that there were perhaps around 1,000 cars there already, with people saying, if you are not here already, don't even bother coming. Is there any truth to those rumours, and have the gates at Epic been closed, or will they be closed at some point in the day?
I will invite the Acting CEO of Canberra Health Services, Dave Peffer, to address that one.
Thank you, Chief Minister. We will need to take an operational decision during the day to identify where we think we will be able to get those vehicles through in terms of the testing capacity of that site. As the Chief Minister mentioned, we have drastically or dramatically increased throughput by opening a further pavilion, and this afternoon we anticipate we'll be able to scale up some additional capacity further to that. However, we will have to make a decision about what's safe, who we can put through before we're talking about people being tested in the early hours of the morning, where the temperature, people in their vehicles for that length of time, just not safe.
What's the advice for Canberrans going to those bigger facilities like Epic in particular? Do they need to be there by a certain point in the morning to have any hope of being tested? I know when it was a little bit quieter, the advice was for people to go later in the day, but obviously that doesn't seem like a feasible option at the moment. What is the advice, particularly for those close contact people who need to get tested? What time of day should they be getting there? Will they get tested even after they're waiting for perhaps 8 hours?
So we'll try and test as many people as we can each day. We'll try and optimise the throughput as best we can. People are arriving from quite early in the morning. We have been observing at sites people queuing as early as 4 a.m. before the sites open. We'd obviously discourage that. However, recognise people are trying to do the right thing, get tested. Each day we do look at logistically what do we think we can handle through the site. And at a point in time we do have to make a call about realistically what can we get through, and we'll always try and make the right call and get that number right. However, yesterday we did at a point in time have to make a difficult decision, recognise that we weren't going to get through all of those vehicles and have that discussion with the individuals in those vehicles.
What time did that happen yesterday, and has it happened already today at Epic?
No, so that same conversation hasn't happened today at Epic. We're observing with the additional pavilion open the throughput, and we will make a decision throughout the afternoon at a particular cut-off point. In terms of that conversation last night, that was held late into the evening around 9:30.
Just back on vaccines. Sorry, one more on vaccines. So the numbers are looking good at the moment, but as Premier Berejiklian was talking this morning, it takes 3 weeks to get some of the efficacy. And given the transmissibility of Delta, how come in places like Victoria, mass vaccination hubs are an appropriate place to have a discussion about informed consent, but with all the supply we have and all the bookings we have here at our mass vaccination hubs, we can't get younger people through there?
We have one AstraZeneca mass vaccination hub. That's the smallest of the 3 that we have that is focused on over 60s. AstraZeneca is the expansion of its delivery in the ACT through dozens of different locations and some on a walk-in basis, so you can walk in today, is GPs and pharmacists. So our mass vaccination hubs are principally Pfizer. And so that was and it remains a sound decision in terms of the delivery of the vaccines and the focus of our effort.
So what's our AstraZeneca stockpile looking for in terms of what the government has on hand?
The ACT government doesn't, because we've only got one small AstraZeneca hub. Most of our AstraZeneca is delivered by the Commonwealth direct to GPs and pharmacists. Let's go back to the start of the vaccination program. The intent was that the Commonwealth would deliver 2/3 to 3/4 of the vaccination program through GPs, pharmacists and their own programs, with an expectation that states and territories would deliver about 1/4 to 1/3 or thereabouts, might have been 37% or something to that effect. What has happened is that states and territories have had to up their share because of some of the difficulties the Commonwealth have had in delivery. And so we're at about 50%. But our focus is on the Pfizer program and will remain on the Pfizer program. We're having the conversation, as I mentioned earlier, in relation to Moderna when that becomes available next month. But we're also anticipating more Pfizer supplies as more come into Australia. And so we're stepping up our focus there. But it will always be, Dominic, that there will be walk-in availability for AstraZeneca through the primary healthcare network and pharmacists.
Can I just ask, when are you expecting to make a public announcement about whether the lockdown will be extended? Will it be late in the week? Will it be something on the Thursday, or will Canberrans know ahead of time whether this lockdown is going to be extended?
Look, as soon as we are in a position to make that informed and considered decision. That's not going to be tomorrow. It will likely be closer to the 7-day period, but we will give some notice. It won't be on the last day, 1 minute before the current lockdown scheduled to end. So it gives you a span of a few days, but it's got to be based on the best and most current information. And that's what we're getting through the level of surveillance we've got now with high testing levels, the sewerage testing, and of course the genomic work, the close contacts, the contact tracing, the entire public health response, which again has been really, really effective in delivering us that information. Okay, thank you very much, everyone.